Hello everyone, this is Kalyana Kumar Shanmuga Priyan. This is my patient. What's your name, sir? What's your age? 19. So we're going to the examination for the sensory testing and reflexes. Are you okay with it, sir? Okay, let's continue with the examination.
Examination of the sensory system and reflexes are to assess pain, temperature, light touch, and vibratory sensation, as well as position sense and discriminative sensation, and to correctly elect the deep tendon reflexes of the biceps, triceps, brachial radialis, knee or patella tendon, and ankle. Sensory impulses participate in reflex activity and give rise to conscious sensation, calibrate body position in space, and help to regulate the autonomic function such as blood pressure, heart rate, and respiration. Assess the pain sensation in arms, legs, and the trunk. To do this, first warm the patient, then use the sharp end of a cotton swab. Stay sharp if previously unused safety pin or some other suitable tool, and tell the patient to close his eyes. Then at the starting with the arm test. Scattered areas in a symmetric pattern on both the sides of the body, occasionally substituting the blade end for comparison between the sharp and dull. Now assess light touch with a cotton wristband. For the stalking of the glove pattern of the sensory peripheral neuropathy, now I'm going to touch the patient with a cotton wrist wherever you feel. I told him to say no. I told him also to close his eyes, and he said perfectly. Next, assess the vibratory sensation using a lightly vibrating low pitched tuning fork. Now the patient closes his eyes and tap the tuning fork on the heel of the hand and place it against the soft distal tissue of the finger and the large toe, and ask the patient to tell what he feels, and I tell the patient to tell them when the sensation stops. The tuning fork to the trunk and see it's perceived. To test position sense, the slide of the patient's big toe with your thumb and index finger. Avoid touching the toes. And then tell the patient to close his eyes and identify the direction of the motion, whether it's up or down. Do it for several times with an irregular sequence. Make sure your patient tell it right and do it with the other leg also. And he said everything correctly. Again with the patient eyes closed, test the position sense in the upper extremities, beginning with the finger on each of the patient hand and moving more approximately to the metacarphalangeal joints and beyond if indicated. Now we are going to do the stereognosis, the ability to identify an object by feeling it, and ask the patient to close his eyes, then place a familiar object. I gave him a coin in the palm and I told him to say which is the bigger coin and which is the smaller coin. Do the procedure on the other hand using a different coin, and he answered it correctly. Now we're going to test the graphostasia or the number identification. We need to ask the patient to close his eyes and use a blunt object to draw a large number on the palm. I wrote 7 and he was able to find it. Now we need to use a two end of an opened paper clip. Now repeatedly touch the patient finger pad with the 2 points at the same time and with 1 point. Occasionally be careful not to cause pain and tell the patient to identify whether he is touched or not with 1 or 2 points. Then reduce the distance between the points so that we can determine the minimum distance at which the patient can identify 2 points on the finger pad. The distance should be less than 5 millimeters. Now I'm going to do the point localization. In this test, I'm going to touch a patient body and you need to find the right place where I touched. This activity should be done by closing the eyes. To test the double extension, we need to keep our fingertips to provide stimulus in either one area of the patient body or in two areas simultaneously. Normally, the patient should be able to identify whether your stimulus was on one side or both. Deep tendon reflexes or involuntary monosynaptic cord reflexes arising from the simulation of the partially stretched muscle fiber. Assessing the deep tendon reflexes, grade them on a scale from 0 to 4 plus. Grade of 0 reflects no response. 1 plus indicates a somewhat diminished reflex. A 2 plus reflex shows greater movement than 1 plus and is the average normal response. A 3 plus reflex is brisker than average but is still normal, and a 4 plus reflex is a very brisk hyperactive response. Begin assessing the deep tendon reflexes by testing the biceps reflex. The patient arm must be relaxed, partially flexed at the elbow and positioned with the palm down. Depress the biceps tendons with your thumb or index finger. Strike your thumb or finger briskly with the reflex hammer. You should feel the biceps muscle contract and see the flexion of the forearm. To assess the triceps reflex, flex the patient arm at the elbow with the palm toward the body and pull the arm slightly across the chest. Strike the triceps tendon above the elbow. Watch for contraction of the triceps muscle and extension at the elbow. To elicit the supinator reflex, the patient forearm should rest on the abdomen or lap with the forearm partially pronated with the patient is ready to strike the radius 1 or 2 inches above the wrist. Observe for flexion. To test the knee reflex, locate the patella tendon with the patient knee flexed briskly. Tap the tendon just below the patella. Note contraction of the quadribs and look for a quick extension of the knee. On the other hand, on the anterior thigh, let you feel this reflex. Supporting both knees at the once allows you to assess the small difference between the reflex of each knee. Test the ankle reflex. If the patient is sitting dorsiflex, the foot at the ankle, ask the patient to relax and strike the Achilles tendon. Watch for the plantar flexion at the ankle and note the speed of relaxation. After the muscular contraction, if the patient is lying down, flex one leg at both hip and knee, rotated externally so that the lower leg rests across the opposite shin. Then dorsiflex the foot at the ankle. Now turn to the cutaneous stimulation reflexes. To test these reflexes, lightly but briskly stroke each side of the abdomen from above T8 to T10 and below T10 to 12. The umbilicus, you should see contraction of the abdominal muscle and sometimes deviation of the umbilicus toward the stimulus to test for the plantar